In today's trying and turbulent political state, one of the major issues facing our country is the healthcare crisis. Many people simply don't have a healthcare plan that fits their needs and, in many cases, a healthcare plan that they can afford. Well, today we have two guests who are going to tell you the secret to getting the healthcare that you or your employees need at an affordable rate. One in which you tailor to fit your specific health and financial needs. Stick around, you literally can't afford to miss today's guest.
Welcome to this edition of Peak Performers Podcast with your host, Thor Conklin. Thor will be sharing the necessary tools, strategies, and psychology you'll need to become a peak performer in any area of your life or business.
Thor Conklin here. We give you the tricks, the tips, the tools, the strategy, the technology, and the psychology peak performers use in order to get more done and execute at the highest level. If you know what to do but struggle with getting it all done, or simply want to raise your game to the next level, this podcast is for you. Sit back and enjoy.
Today's guests are Keith Michelfelder and Ashleigh Baratta. Keith is a liaison between the broker-dealer, RIA Network, and Fortress Brokerage Solutions. Keith has spent over 20 years in the securities industry and is responsible for designing individual and corporate advanced planning solutions. Ashleigh has a myriad of responsibilities at Fortress, including, but not limited to, hiring quality professional agents, servicing case development and case design needs, in addition to improving and maintaining Fortress's customer relationship management systems. Together, Keith and Ashleigh help individuals, as well as corporations, select and customize their preferred health insurance coverage.
Ashleigh, Keith, thanks for joining us today. You know, the audience is really in for something special today because this is, I think, the second or third time that we've actually done this format. So I'm going to apologize up front. We are live in the studio, and the wine is flowing. So it's going to sound great in the beginning, and hopefully it'll actually land okay when we get to the end of this. So welcome, Keith, Ashleigh, thanks for joining us.
Thank you.
Thank you for having us. Appreciate it.
Man,
We're risk management folks, so by the end, we'll make sure the risk is managed to where we won't be terrible at the end.
That's right. And nobody's driving. We're taking Uber today.
There we go.
Well, today is going to be a really interesting episode because we have entrepreneurs on, we've got people that are performing at their peak, and one of the things that always affects entrepreneurship and business leaders is health insurance. So before you tune out, because I don't want you to tune out, everybody needs to understand what's happening in health insurance, how it's changing, and the solutions that Ashleigh and Keith have on the table. So without further ado, tell us a little bit about what's happening in today's marketplace.
All right, everyone. So what we're doing here is we are bringing a low-cost health insurance alternative to you and business owners. This is something that you can use for yourself. This is something that you can use for your employees. It will offer benefits that are similar to major medical insurance, but cut your price range down. What would you say, Keith, 300%?
I would say it's a dramatic cost savings, and it's a dramatic cost savings versus the bronze care of Obamacare that's going to be up projected 32% this year.
When's this ever going to stop?
The ACA?
No, the price increases.
Oh.
This is getting ridiculous.
The price increases do not stop.
We can't afford it.
If you bring 350 million people onto a platform, if it's any platform, okay, and you mandate that they have something, the only way the end user or the business can make money is to do what, Thor?
Competition?
Raise the prices.
Raise the price.
Prices.
We already got trick questions and we just started.
The insurance companies are never going to lower the amount of money that you have to come out of pocket for your insurance, your health insurance. It's always going to increase.
Well, one of the things that really drove me nuts is I have pregnancy insurance. I'm a dude. It's just covering me. Why am I paying for pregnancy insurance?
That is part of the health insurance contractual language. It goes in for every single person, and no matter whether you're a male or female, you're paying for it. It's part of the risk share.
I object. I don't want to cover health insurance. I don't want to carry it.
Well, then,
what happens then?
You don't want to carry the baby, or you don't want to carry the insurance?
Either. You should be thankful that you're sitting here with us, Thor, because that means you have the opportunity to look at the My Health Pass, which is the preventative health insurance plan that we are discussing with you today on air.
Awesome. All right, now we got to go basic, okay? Because when we start talking about health insurance, my eyes start to glaze over. Give me a P&L, give me a balance sheet, give me a strategic plan. Great. Health insurance, I just tune out. And I think a lot of entrepreneurs do the same thing. But it's something that we have to be aware of because it's mandated now. And if not, you actually get dinged in your taxes.
I'm like you. I come from the world of finance. I come from the world of the stock brokerage world. Once you hear insurance, you immediately go to sleep. It's the ambient term of the English language. However, there is an acute need here that speaks to everybody, and there's an opportunity. So as an entrepreneur, you need to jump on that.
So what's happening right now? Is something going to affect on January 1st, 2018? I know I read somewhere that, this year is when the fines go into effect. I thought they already went into effect.
They have been slowly rolling out this penalty to everybody. And what that means is a couple years ago, they started out when ACA first started taking
What is ACA?
The Affordable Care Act.
There's nothing affordable about it.
There is the Unaffordable
I'm just going to call it the
Act.
CA. I don't even think it's a CARE Act. It's just an act. We're just going to call it the A.
Unaffordable Care Act is really weird.
Unaffordable Care Act. That's what I like.
So when this Unaffordable Care Act came out, they slowly rolled it out to the public. And what that means is if you did not have health insurance that was, quote, up to code of what the ACA decided code was, then you would be paying a penalty that would be assessed against your taxes. So if you pay taxes at the end of the year, you would pay more taxes with the penalty at the end of the year. If you receive money from your taxes in April, then that would be subject to the penalty, so you would receive that much less if you did not.
And what
have
sort of
health
fines are
insurance.
we looking at?
When they first rolled it out, it was about the $550. We're getting up to about $2,500 now for the year.
Because at $500, that's cheaper than getting the insurance. But at $2,500, now it's starting to be real.
Well, the issue really comes in where, let's say you've got a family. You're a husband and a wife, you've got two children, and you need to buy health insurance for your family. The cost is going to be anywhere between $500 and $1,000 a month for a family.
Yeah.
Then you've got a deductible anywhere from $5,000 to $10,000. So the reason why the Unaffordable Care Act becomes so unaffordable is because now you have to pay $5,000 or $10,000 deductible before the insurance even gets the opportunity to begin paying for you.
There's a lot of entrepreneurs out there that write in all the time and talk about getting a side job that actually has the benefits, or their wife or their spouse is going to work just for the benefits.
That's right. I kind of ring it home back to myself, and I like to use myself as an example because I'm turning 26 actually this month, so I'm actually getting kicked off my parents' health insurance. I have to.
So I can get rid of my kids at 26?
Yes.
All right, just
legally.
a few more years.
They cannot stay on your health insurance plan.
All right, Jason, Nicole, you heard that, right? You guys are off.
And so with that being the case, I've got to go out and look out for my own health insurance. Well, last year, I'm on my mother's health insurance plan. She's with Southwest Airlines, so it's a very large company. They can afford the cost to get this very good health insurance plan for their members, right? I fell last year, broke my arm. I broke 2 bones, 2 ligaments, a tendon, and cracked the cartilage. Needless to say, I was in open arm surgery the next 5 days later. What did this cost me? This costed me $8,000. $8,000 at the age of 25. What 25-year-old has $8,000 just sitting around to throw at medical bills? Not many. So the reason why I had to pay that was because $8,000 was the cap on my insurance. I had my medical bills.
The deductible or self-insured retention?
No, we actually call this the maximum out of pocket.
Okay.
Maximum out of pocket means it's the maximum a insured can pay out of pocket before insurance pays for absolutely everything thereafter.
Okay.
Everyone makes that mistake. They think the deductible is their biggest risk. That is completely false.
Okay, but what is the difference between deductible and cap?
Okay, so there are 2 differences. The deductible is what you pay before insurance kicks in. Let's use numbers. An explanation always explains it better. Let's say I have a health insurance with a $1,000 deductible. I go to the hospital, I break my arm like I did last year, and I have to have a surgery. So I have to pay $1,000 before insurance decides to pay their co-insurance percentage. Typically, a co-insurance is 80-20. What that means is the health insurance provider will pay 80% of the cost, and the insured will pay 20%. So I pay $1,000, then I pay 20% of the cost of the procedure, with the cost of the copays that it cost me to go see the doctor, with the cost of the prescriptions that it cost me to, manage my pain, and the cost of the procedure to put my injury back together, my arm back together. I will incur expenditures up to a maximum amount. This is what we call the maximum out of pocket. For me, it was $8,000. So I paid $1,000, then I paid my co-insurances, then I paid my co-pays, up until $8,000 total.
Got it. Now, I own a company. Do I have to buy health insurance for my employees?
Yes.
I do.
You do.
Every single one.
Every single one.
What if I decide not to do that?
You will be subject to the penalty, and so will your business.
Interesting. Now, are there levels if you have a certain number of employees?
If you have your employees signed up as independent contractors, so they're at 1099, that's true. This is what's happening.
Yeah.
If they're at
But the government doesn't like that either.
The government doesn't like a lot of things, but that's really the trend that you've seen. You see a lot of contract work coming out instead of actual full-time work. So this plan has made it where people don't have benefits because it's the owner is in a position where they have to make 1099 employees and push the onus back onto the employee, or else they go out of business.
Well, and they go out of business if they end up paying these kind of costs as well. So it's catch-22. All right, so we know what the problem is, and nobody out there in business doesn't understand what the issue is. It's getting worse. The penalties are getting worse. The healthcare coverage is not getting better. It's not getting less affordable. It's getting more unaffordable. So what are the solutions? What's available out there?
So in order to be in compliance with the Affordable Care Act, the Unaffordable Care Act, we have to meet certain points that Obamacare has laid out for health care to be, quote, certified, approved. And some of these points will allow us, it's about a 39-point structure, which says you have to hit certain health preventative benefits in order to be considered approved for Affordable Care Act. And
Pregnancy coverage for males.
Pregnancy coverage for males. Yes, exactly.
That's one of them.
Because that makes total sense, right?
Right. So every health insurer has to hit those 39 in order to be qualified.
At least.
Or
better.
Okay.
And that's where you would come in at the major medical. But of course, major medical is very, very expensive. So we have some other options. And that's really where Fortress Brokerage Solutions has pieced the puzzle together. Okay. So what you can do is you can do a preventative healthcare plan. What does that mean? A preventative healthcare plan, in accordance with the Affordable Care Act, provides all of those healthcare points, preventative needs that we have to meet to be as good or better from what is approved by Obamacare. And it does that. And it basically says that if you're a female, you need a mammogram. If you're a man and you need to have your prostate checked. If you want to have shingles, if you want preventative needs for shingles, preventative needs for flu shots, all of these things culminate together to create what we call a preventative healthcare plan. So what we have done is we've taken this preventative health plan, which allows you to have all your preventative needs, and we are pairing it with outside solutions. Outside solutions like dental and vision. So now you have preventative health, dental and vision. Outside solutions like a hospital indemnity accident plan. So if you're like me, and you last year fell and broke your arm, you now have coverage to go to the hospital, the ER, put back your injury, put back your arm break. If you need to have a CAT scan, an MRI, these are things that are covered. So we're pairing a preventative plan to keep your preventative wellness in good check. Dental and vision, so now you can have your eye exams, your dental exams and x-rays, as well as an accident and sickness critical illness plan, so that if something should come up along the way, life hits you like a sack of potatoes in the back of a head. You never know what's going to happen. And when those times happen, we will get you covered with this puzzle piece of, how should I say?
It's scalable. So the first part, the preventative, that's going to get you out of the fine, is not overly expensive.
So let me make sure I understand this, because I'm a little confused so far, or just on this point. The preventative that you're saying that you put together, that meets not all 39 of these.
No, it does.
It does.
Oh, the preventative meets all 39.
So it's approved for the ACA, so you will not pay the penalty.
Okay, so then what's the difference between my major med that's going to cost me $40,000 for the year versus my preventative?
So the difference comes in that you have access to go to all of your doctors for, you get a sickness, you get a cough, you get strep throat. What do? You go to your primary care physician, right? He says, all right, Thor, I'm going to write you a prescription for an antibiotic. Go to your pharmacy, pick it up, and be on your way, right? The difference is you don't really get that with a preventative plan. A preventative plan says you get to see your doctor for these preventative needs, mammogram, all these types of different preventative options. And that's what you see your doctor for. So then you ask me, well, what about if I get a cough? What about if I get strep throat? What if I have a rash? That's where telemedicine comes in. Telemedicine is very, very relative. I don't know if you guys had seen what our new president had done for the VA, but introducing telemedicine was one of the options. Just kind of quickly touching on the VA, they've had a lot of problems helping our veterans in the past. And so one of the things that they're trying to do is they're trying to bring telemedicine, I'll explain what that is in a second, to veterans. This is what we are doing in conjunction with this preventative health plan. Telemedicine is the ability to have a doctor in your pocket 24/7, 365 days a year. Doesn't matter if it's 1 in the morning, doesn't matter if it's 1 in the afternoon. If you wake up, you got a rash and you're freaking out over it, instead of going to your primary care physician down the street where you have to take off work, maybe you have to get your kids later to school than expected to go get your rash looked at. You can go on your telephone, open up the app, you put your information in, and within 5 to 10 minutes, a live doctor from your region will call you and will ask you what's going on. So Thor, you may wake up one morning and you've got a sore throat and you're really not feeling well and you've got a show to do that day. You cannot be late. You can't miss it. And you've got to sound good in your microphone, right? So you think, oh, what am I going to do? I don't have time to go to the doctor. I've got to prepare and I've got to sound good on air. So what you can do is you can go on your phone. You type in your information. In about 5 to 10 minutes, a doctor will call you and he'll say, Thor, what's going on with you today? And you might say, Doc, I've got a sore throat. Maybe I've got some phlegm going on. I think I've got some type of cold or laryngitis that's brewing. And he'll say, all right, I can kind of hear it in your vocal cords. It sounds like you're scruffy in the phone. I think I need to give you an antibiotic here. And we'll knock this virus in the bud before it even gets going. So within 10 minutes, you go down to your pharmacy, your local pharmacy here. You pick up your prescription and you're on your way.
And what if I need lab work?
Lab work is included. So one of the things I really love about the My Health Pass is we provide additional benefits beyond teledoc, the doctor in your pocket. The additional benefits are lab work, like you said. The 2 largest chronic diseases that we have in the United States is heart disease, number 1. Number 2, diabetes. Typically, diabetes number 2, mellitus, that's adult onset diabetes. And so for blood work, what we do with the My Health Pass is you get 2 times a year, we will send out to your house a finger prick, and a glass slip, and you finger prick yourself, you send it on the glass slip, you send it out, and the lab will come back with your results. You get 2 free each year for diabetes and heart disease, if you should want to check your B12, if you should want to check your D3, if you should want to check all the other platelets out there with your cholesterol, your lipids, all of these things may come at a small additional price, a couple bucks here or there, but that's something you can actually do without going to see your doctor, where people are sick and paying the copay and taking the time off work.
It's a weird concept. The concept is scalability, right? Let's just roll back.
What do you mean by scalability?
Your $85 or whatever it may be for your preventative knocks the Obamacare out of your pocket.
So I'm looking for I'm looking about $85 a month for the preventative.
Roughly.
Okay.
The preventative. Then you can scale in what you want. So it's a
Okay.
novel concept in this country these days that you can
So
make.
I just want to make sure that I don't throw the audience off, because when we talk scalable on this show, we're talking about how to take our business to the next level and do it in a scalable way.
Okay.
So
This is also a proper use of scalable.
hey, well,
and it means designing your plan for you.
it's a platform.
It's
a
design-
platform that you can build.
It's a platform that allows you to design your plan for you.
Okay.
Okay. You just talked about how ludicrous it is that you have to carry insurance for pregnancy. Why, if I'm a regularly healthy 26-year-old, should I have to carry all these other things that are going to cost me money? Why can't I tailor make something that's ACA compliant to myself and to my needs?
Got it.
And that's what we've cobbled together.
Okay, that makes total sense. Now, big question: I break my arm. What happens now? I've got preventative care, but I don't have any insurance for my broken arm.
She answered that question.
The answer to that question.
Well, let's answer it again for Thor.
The answer to that question, Thor, is you're right. You would not have the coverage through a preventative plan.
See?
Well,
You would not have the coverage through a telemedicine plan. But what we are doing here is we're customizing a plan that fits all of these needs, right? We're in conjunction with the preventative, in conjunction with the telemedicine, we're also going to be providing an accidental injury hospital indemnity plan. So if you should break your arm and you go to the hospital, this plan will cover X amount of dollars per day in the hospital. If you should break your arm and go and have to have a surgery like I had to, this plan might cover $2,000 or $3,000 per day for the surgery reconstruction.
Okay. All right. Now, you know what the follow-up question is going to be?
What's that?
Heart attack, something like that. What happens then?
It's the same exact scenario. That hospital indemnity plan will cover these. Anything.
Hospital identity plan is a bolt-on to the preventative.
Exactly.
Okay, so now let's see, I told you that the wine was going to kick in. Let's talk about the cost. We're starting with $85 for the preventative. We've bolted on an accident plan. Then we're putting on a major medical plan. Are we not going to just...
We're not putting on major medical.
Okay.
Major medical, typically only people who can afford major medical today are having it subsidized by their company.
By the companies. Okay.
So
All
when
right.
they
So-
look at their W-2 or they look at their paycheck, they're like, well, health insurance hasn't gotten that bad. I'm only paying $180.
It's being subsidized.
Yeah, it's because it's being subsidized
All
by
right.
your company.
Right. All right, but I want my heart attack coverage. I mean, I got to sit here. I got to interview you guys. You give me a heart attack already talking about all these costs.
So, you're starting to think the costs are adding up, right? Let's say we've got $85 for preventative. We've got $25 for telemedicine. We've got about $30, $40 for an accident hospital indemnity plan. And then depending upon what, I should say, criteria you want in your critical illness plan, could run you anywhere from $40 to $80, just depending
Wow.
upon how much you want to beef it up.
And vision and teeth.
And vision and dental, which
Okay.
typically can be between, you're looking at as low as $15 and as high as $65.
I'll give you an example of a case we just worked.
Okay. Keep talking for a while because I'm going to grab some more wine.
Okay. Give you an example of a case we just worked. Two 35-year-olds, married. One owns a franchise here that you would know instantaneously. The other is a medical professional. Both are responsible. She's a sole prop, so both are responsible for their own health care. When he bought the franchise, he was working for a Fortune 500 company, and he was covered by their insurance, subsidized, correct? So now he needs to work out what's going to work for him and work for her. We were able to put together a plan that met their needs for about just around $200 a month each. That's going to cover them if they break their arm, if they have a heart attack, if they get a burn. The only thing it's really not going to cover them for is if he gets pregnant.
It'll cover her, however, though, if she gets pregnant.
And what happens regarding pre-existing? How are you determining any of that? Are there medical
Good
exams?
question.
That's a great question.
What's great about this is pre-existing conditions will not play in. The only time for the preventative, for the telemedicine and the dental and vision, the only time existing conditions may kick in is for the approval of the critical illness policy, if that's something you want to tack on. And
So the underwriting of that?
yes,
Okay.
the underwriting. And
So kind of old school on that, like it
It's-
used to be.
it's things like heart attacks, strokes, cancer. Those are the types of big line items that are going to kick you out from being approved from a critical illness plan.
Got it. Okay. And that's real. Isn't that really the difference? Is what's happened with the Unaffordable Care Act is that there is no one excluded. So since everyone's included, we've taken in a lot of what would have been uninsurable folks.
Well, there's two problems happening here.
And I'm not saying that's a bad thing, but that's what's happened, and
Well,
that's what's driven up the cost.
And actuarially, you come from an insurance world before you had this
I
show,
do
so
indeed.
You understand
But
risk
I was a
management.
P&C guy, not a health insurance guy.
Same though. You're looking at
Same.
risk. So you're looking at, well, everything comes down to a risk pool, right?
Yeah,
So what
absolutely.
we're seeing opt in is we'd like to see the centennials and millennials opt in to balance out the baby boomers.
And you're saying they're not right now?
Well, they can't afford it, and they're not getting hired for anything but contract work. So it's not getting balanced out.
That's right.
Okay?
Yeah, that's true.
And then you still have 7 million Americans who are uninsured, even though they're mandated to be.
Yes.
Okay? So that's causing the problem. That's part of the risk pool is causing the premium to go up. Now, our president didn't do us any favors by at the last minute going into open enrollment, making this even a murkier situation. But our solution is very clear. Our solution is you own the policy. Keep that in mind. It's portable with you. Thor works for whatever company. Thor works for X restaurant. Thor's a GM at this restaurant. He can't afford $300 a month. He can afford $200 a month possibly, and maybe he doesn't even need that because Thor's 26 and in relatively good shape. So maybe we scale him down to a $100 policy or $112 policy a month, something he can afford and be compliant. The other neat component about this is Thor owns the policy. Thor decides that he doesn't want to work at said restaurant anymore because the owner is a dictator. He can move on and he takes his policy with him. Another novel concept, ownership of your own stuff here in this country.
Now, this is a question I'm going to ask. I don't know if you know the answer to, but if I have my own company, can the company pay?
I don't. Ashleigh does.
And if you don't know the answer, that's okay. If I own my own company, can I have the company pay for this for me on a pre-tax basis, or do I have to pay for these premiums on an after-tax basis?
It would be paid for an after-tax basis.
I don't like that. But that's what it is. That's what it is.
But it's significantly cheaper.
Yeah.
You're never going to really be able to replace major medical at a price which is being subsidized by the company.
Yeah.
Okay.
I mean, I pay after tax now. So, I mean,
Let me ask you a question. You're a super healthy adult male who's not pregnant.
good looking.
Debatable.
Intelligent, witty.
Debatable. What are you paying as an entrepreneur for your health insurance? Would you like to share that with the audience? Because I bet you the number's staggering.
$530 a month, and it has an $8,000 deductible or self-insured, whatever. $8,000 till anybody starts paying.
So, Thor, how do you feel about that?
Well, I'm very happy that I'm doing my part in subsidizing the rest of the group.
And so how much a year?
No, I mean, look, I'm very fortunate. I can afford that. It is a lot of money, and I know that a lot of people can't do that.
So-
And that's a shame because everybody, I think, has the right to have health insurance, clean water, and safety. So it's a big problem. It needs to get fixed. The government did not fix it when they did the ACA. It's broken. Go ahead.
I mean,
Jump in.
When have we ever seen the government walk into a problem of this magnitude and walk out and say, "Oh, it's fixed"? The scariest words in the English language. I'm
Right.
from the government.
I'm here to help. Well, I'm glad that there's some alternatives because, quite frankly, I didn't realize that there were any alternatives. And again, It's something that has not been really high on my list. It's just something that I said, okay, it's a cost of doing business. I need to insure myself. I'm just going to do what needs to get done. Now, there's an open enrollment period, which I guess starts November 1st. We're in that period right now. That's the only time that you can buy new insurance. Does that also apply to what you're talking about, or does open enrollment does it not apply?
No. So
No, it doesn't apply, or yes,
it does
apply?
not apply to the open enrollment.
So you can buy what you're talking about, this bolt-on program, at any time during the year.
Anytime during the year.
All right. Now I got to ask a question. ACA, government says, hey, you got to buy this. You got to buy it from us. You've got to buy it from the approved insurers. It's got to fit all these guidelines. You're going to pay a lot of money. And you can only buy it from November through December 31st. And what you're telling me is that you have put together a program that I can buy at any time during the year. I can decide the things that I want and the things I don't want. And I'm still in compliance with their rules. I'm not going to get dinged on my taxes. That makes no sense to me.
It makes exact sense. It says that you...
What says?
The sense is that if you're going to buy into major medical insurance, it has to be in compliance with the government nowadays, right? So I
guess I haven't seen that in my mind. I didn't differentiate between major medical insurance and health insurance and preventative insurance. I looked at it as one thing.
Okay.
Expensive health stuff.
That's okay, because if you think about it this way, your health insurance is your major medical insurance, okay? What we are doing here is we are saying, no, there's a couple different kinds. That's what I want you to know.
That's what I didn't understand.
Most people don't understand
exactly.
that.
And that's why I want to point out that if you're listening today and you're as confused at some points during the process, don't worry. I'm hearing this for the first time. I'm not seeing this on CNBC or Fox News or CNN.
When I approached Thor about doing this interview, because we wanted to do it during this time because it's getting a lot of coverage and scaring a lot of people. People are scared, and his eyes glazed over, and it's like, really, you're going to come here and talk about health insurance? I said,
I'm like, no.
Yeah, exactly. One of the reasons that I left what I was doing to work with the Baratta family was I said, wow, this is innovative. This is entrepreneurial, and this hits a need that everyone has to have, and it hits home. So when Ashleigh explains it, if there are any questions you have, trust and believe your listeners do, slow her up. Have her explain the rest of it, because she's a technical wizard on this.
Well, good. At the end of the show, we're going to give out all your contact information. Reach out to either Keith or Ashleigh and find out, for more detail. But I think the timing's absolutely perfect with this going into the open enrollment period that we currently find ourselves in. Mm-hmm. Thank you so much for listening today. I really do appreciate your time, and I hope you found today's show valuable. If you would like to receive these shows automatically to your phone or to your computer, simply go to iTunes and subscribe. After listening to several of the shows, if you're so inclined, please leave us a 5-star rating, as this helps us reach additional people and spread the message. If you're truly committed to taking your life to the next level and doing whatever it takes to become a peak performer, but something's holding you back, something is blocking your way, and you just can't seem to figure out what it is, send me an email to info@thorconklin.com, and I'd be more than happy to get on the phone with you. We'll schedule a 15-minute discovery call. No obligation, no cost. I absolutely love to hear from the listeners, and if there's something I can do to help, I'd be more than happy to do that. Also, if you found something of great interest in today's show and you want to share that with your friends and family, simply go to my Facebook page, Thor Conklin, click on the episode, hit the share button, and share it on your page. You can follow me at Twitter at Thor Conklin. The website is thorconklin.com. We're constantly adding new free resources, discussing additional tricks, tips, tools, and strategies on how to be a peak performer. Remember, I try to keep these episodes short so you can listen to them during dot time, doing other things, commuting, driving, walking, working out. Decide to be a peak performer in all that you do. And until tomorrow, have an absolutely amazing day.
Be on the lookout for part 2 of our conversation with Keith and Ashleigh, where they tell us how technology has completely changed the healthcare industry, as well as how you can implement these changes to help your business customize the perfect healthcare plan for yourself and your employees. I'll see you guys on another edition of Peak Performers Podcast.